We're in the home of Mr. Pat Boland, who is a 57-year-old gentleman and has been on testosterone replacement for a little over a year and a half. And why was it that you first came to me about your testosterone?
My wife first presented the idea of testosterone replacement to me by speaking with a doctor and also having gone on testosterone replacement therapy herself.
And she had a positive effect.
She had positive effects, yes.
And what was it that was bothering you that made you even think about replacing your testosterone?
There was about a 75% libido loss in me, and I couldn't deny it.
Was that getting worse?
It seemed to be gradually and progressively getting worse.
Getting
yes.
worse. Not something you were happy with?
Not something I was very pleased with, no.
At that time, had you noticed that there was any change in your energy, any change in your strength, physical strength, any change in your mood, anything like that? Had anything like that happened?
I had been diagnosed with depression in 2003, and I noticed that life itself was becoming more chore-full. It seemed like everything was a chore. And yeah.
Okay, so you came to me and you went and had a blood test done, and the blood test showed that you indeed were deficient in testosterone,
yes.
And very few men your age would not be deficient. And we started you on testosterone replacement. So tell us what happened.
Almost immediately there was an increase in libido, and the sexual effect of it was pretty dramatic and also really nice, but nothing extraordinary, nothing that was out of bounds, no. But I also noticed over time an increase in my ability, in my capacity to just do the choreful type things of life, like tying up garbage. I've always been somewhat of an athletic guy. I like to run, I like to do push-ups, and I noticed an ability to do those better, to run better, and to feel better afterwards also.
So you, despite the fact that you really hadn't been aware of any loss of the physical ability, when you replaced the testosterone, there was a resurgence, made you really realize that you had lost something.
Right. I was easily able to recognize that I was more athletic, I felt more muscular, and I felt this increased capacity, as I say, to just do things.
Did your libido return to what you would consider to be a satisfactory level?
Yes, absolutely.
Okay. Now what about the psychological changes? What about the depression?
The depression, I noticed myself, just in retrospect, that the depression that I had been diagnosed with was probably getting a little bit worse. I haven't been on meds in quite some time, since 2004, but I noticed that the depression was getting a little worse and a little very gradual. After testosterone therapy, I also noticed that my sense of self-esteem increased. And I've always been sort of a can-do kind of a guy, and I noticed that just my ability to be able to do things with more vigor helped me with that. And I find no needs for any antidepressants.
So the depression has lessened?
Yes, absolutely.
Significantly?
Significantly.
Okay, and I guess we could sum it up by saying that the testosterone replacement has just made you an all-around happier guy.
Oh yeah.
That's the best word for testosterone. That makes you happy.
Yeah, testosterone equals oh yeah.
Okay, thank you very much.
Thank you, doctor.